Self-Talk with Dr. Akram. I'm Akram. In this program, we'll be talking about all kinds of different health issues with different experts in the field. But today, I have decided to talk about gout arthritis. So sit back, relax, and enjoy with us. Why gout arthritis? Gout arthritis is not uncommon anymore as it used to be. It is quite personal for me because I have developed gout arthritis 2 weeks ago, and for 1 week I was going through agony, and it took me 1 week to completely diagnose it and make sure it is gout arthritis before I wanted to start the treatments, because I usually don't like to take medications, and I'm not the person who would like to prescribe lots of medications as well. So that's one of the reasons. Anyway, let's look what is gout. Okay, is gout a rich man's disease or king's disease, as it has been known since antiquity? Historically, it was referred to as the king of disease and the disease of kings. There must be a reason for that. Yes, because those days only rich person could permit high protein food, and only rich person had gout arthritis. But it's not the case anymore. Gout is a form of inflammatory arthritis characterized by recurrent attacks of red, tender, hot, and swollen joint. Pain typically comes on rapidly, reaching maximal intensity in less than 12 hours. The joint at the base of the big toe is affected in about half of the cases. Other joints, such as the heels, knees, wrists, and fingers, may also be affected. Joint pain usually begins during the night. On my case, it was exactly the big toe and on my left foot, and the pain came after exercise, after about an hour of exercise, when my body started cooling down. An episode of gout usually lasts for about 3 days with treatment and up to 14 days without treatment. If left untreated, you are more likely to have new episodes more frequently, and it can lead to worsening pain and even joint damage. Who gets gout? Gout occurs more commonly in those who regularly eat meat or seafood or drink beer or are overweight. I eat meat, but I don't eat too much. I eat seafood. Not much, don't drink beer, but overweight, we'll see about it.
Gout is a chronic crystal deposition disease that is the most common inflammatory arthritis. Prevalence of gout is rising. This is potentially due to trends such as increasing age, obesity, and lifestyle factors. In most patients, gout is caused by inefficient renal excretion of uric acid. Decreased excretion of uric acid leads to hyperuricemia, or elevated uric acid levels in the blood, causing urate crystal deposition in the joints, organs, and other connective tissues. Gout and hyperuricemia are independent risk factors for hypertension, CVD, CKD, and diabetes, and have been linked to obesity and osteoarthritis. In humans, uric acid is the natural end product of purine metabolism. The production of uric acid comes from two sources: the degradation of purines during normal cellular metabolism and the breakdown of dietary purines in the gastrointestinal tract. Most uric acid produced by the body is eliminated by the kidneys, and the remainder is eliminated by the gastrointestinal tract.
Cause and pathophysiology. It's a disorder of purine metabolism and occurs when its final metabolite, uric acid, crystallizes in the joint. These crystals are enveloped by a thin layer of protein. When this protein wall gets broken due to a minor physical damage to the joint, medical, surgical stress, or rapid changes in uric acid levels, the naked crystals trigger a local immune-mediated inflammatory reaction. That's what happened to me. I was exercising, but that was not even for too much. It was about 20 minutes on treadmill. Then I did just upper body. So that 20 minutes just triggered that broken those crystals from its protein envelope and the inflammation started. Contributing factors. Lifestyle. Dietary causes account for about 12% of gout and include a strong association with consumption of alcohol, fructose sweetened drinks, meat, seafood, as I said before. And the second part is the excretion from through the urine. That counts to about 90% of the dietary causes anyway. Genetics contribute about 60% of the persons, and well, my family, my maternal auntie and maternal uncle has gout, which is quite rare in a country like Sri Lanka, but I assume these genes would have come through our ancestors who possibly migrated from North Africa or Middle East. Anyway, medical conditions, other medical conditions. Some medical condition has been associated, such as abdominal obesity, hypertension, insulin resistant, and abnormal lipid levels. These are the two factors quite important here, is abdominal obesity. But you might look normal, but your abdomen is slightly bigger than usual, but there are lots of fat layers inside. That is called abdominal obesity, which is quite high likely in Asian population, and they tend to develop a huge percentage of abdominal obesity. Hypertension, which is easy to measure, and insulin resistance is a pre-diabetic condition where there are lots of insulin in the body, but that insulin does not function completely, but these insulin somehow inhibit the excretion of uric acid through the kidney. What can we do? How do we diagnose it? Investigations in someone with hyperuricemia and the classic acute arthritis of the base of the great toe, called Podagra, is the diagnosis, but plain x-rays are usually normal and are not useful in this case. We could also do blood tests. Hyperuricemia, classic feature of gout, but nearly half of the time gout occurs without hyperuricemia, and most people with raised uric acid levels never develop gout. Thus, the diagnostic utility of measuring uric acid levels is limited. In my case, it was above the normal, so positive. The other blood tests commonly performed are white blood cell count, electrolytes, kidney function test, and erythrocyte sedimentation rate. These are quite important because when you have a diagnosis, you want to make other possibilities eliminated. That's called differential diagnosis in medical terms. And you always want to exclude an infection and other arthritis. Let's go into treatment. How can we treat this condition? We could treat it medically with tablets, or we could treat it with diet and lifestyle changes. These are quite important for a person with gout. Treatment with non-steroidal anti-inflammatory drugs such as ibuprofen, or I have taken naproxen, and steroids can be used, and the other one is colchicine. That's been given by the pharmacy in a small container. It's very little tablets, quite specific for this condition. Anyway, once the acute attack subsides, levels of uric acid can also be lowered via lifestyle changes, and those with frequent attacks, allopurinol or probenecid provides long-term prevention. And also taking vitamin C and eating a diet high in low-fat dairy products may be preventive. Non-medical, we'll be talking about diet here and the lifestyle, what we need to do. Diet is quite important for this condition because it's mainly a product of diet. It's a high protein diet, which causes about 10%, as we said, for the condition. So let's look at it. What food should you avoid? All organ meats. These include liver, kidney, sweet bread, and brain. Game meats examples include pheasants, veal, and venison. Fish. Lots of fish which you can't eat here: herrings, trout, mackerel, tuna, sardines, anchovies, haddocks, and more. Especially dried anchovies also not allowed for this condition, and other seafood, scallops, crabs, shrimps, and raw sugar beverages, especially fruit juices and sugary sodas, added sugars, honey, agave, nectar, high fructose corn syrup, all yeasts are not allowed. Additionally, refined carbs like white bread, cakes, and cookies should be avoided. Although they are not high in purines or fructose, they are low in nutrients and may raise uric acid levels. That's also good because we talked about abdominal obesity, and this kind of food causes abdominal obesity, so that will help you to reduce your weight as well. Okay, what food should you eat? Although a goat-friendly diet eliminates many foods, there are still plenty of low purine foods you can enjoy. Fruits. All fruits are generally fine for gout. Cherries maybe even help prevent attacks by lowering uric acid levels and reducing inflammation. Vegetables, all are fine generally. Potatoes, peas, mushrooms, eggplants, dark green leafy vegetables. Legumes, all legumes are fine, including lentils, beans, soya bean, and tofu. Nuts, all nuts and seeds are fine, and whole grain is preferred for when it comes to oats and brown rice and barley. Dairy products, all dairy products are safe, but low fat dairy products seems to be beneficial. Eggs are fine. Beverages, coffee, tea, green tea are okay. Herbs and spices, all herbs and spices are fine generally, and plant-based oils including canola, coconut, olive oil, these are okay with it. Foods you can eat in moderation. Those are the foods which we have said earlier that you can't eat, but you could eat them in moderation. These are the ones actually. Aside from organ meats, game meats, and certain fish, most meats can be consumed in moderation. What is moderation means? I've been looking at in the internet what is moderation. There is no serious article about it, but I assume moderation means probably eating once or twice a week, but not eating too much. Okay, let's look at the meats. That include chicken, beef, pork, lamb, or the fish. Canned salmon, and generally salmon seems to be okay with this condition. And of course, add more fiber to your diet. And the next one is the can cherry juice prevent gout? This is cherry juice, which I bought from Holland & Barrett, and it's a concentrated juice. It lasts probably a few months as it look like. You need to drink only 4 lid full of cherry juice a day or twice a day. And according to the study, cherries reduce uric acid because they contain anthocyanins. Anthocyanins, which is what gives cherries their color. Anthocyanins also have anti-inflammatory properties, which makes cherry juice a natural anti-inflammatory. This may help ease the swelling associated with gout. Here we go. And can apple cider vinegar treat gout? This is apple cider vinegar, again from Holland & Barrett. This is a pure product, and of course you could buy from other internet sources or other shops as well. You need to look at it to see whether it's pure product. Anyway, can apple cider vinegar treat gout? There are no scientific studies evaluating the use of apple cider vinegar in the treatment of gout. However, apple cider vinegar may help you lose weight and reduce inflammation, which will reduce the amount of uric acid in your blood. Well, how do you drink apple cider vinegar? Again, take a few spoonfuls, put it in a bottle and mix it with water and drink it over the day. That sounds good, but they say that your teeth might become sensitive in that case. Once you finish drinking apple cider vinegar, drink some normal water so that the acidity doesn't remain in your teeth. And of course, apple cider vinegar helps eliminate more uric acid through the kidney because it changes the pH of the water in the kidney, of the urine of the kidney. So it makes it alkaline, and eventually more acid, uric acid, get eliminated through the kidney. Anyway, the next one is a CBD oil, cannabis. Well, cannabis help gout. Some studies have indicated that cannabis may be beneficial in treating the joint pain and inflammation linked to the disease without the unpleasant side effects. Well, cannabis has been used for thousands of years in the history. Well, here we talk about not smoking cannabis or anything. It is the oil form of cannabis which is helpful, and you could apply it over the affected joint. Other lifestyle changes you can make, of course: lose weight, exercise more, stay hydrated, reduce stress. Stress and poor sleep increase inflammation. Inflammation may be set a high uric acid levels. And of course, limit alcohol intake. Alcohol, especially beer and products like beer, these are the ones which increase the uric acid levels, should be avoided. If you want to drink alcohol, go for wine instead of beer. And try vitamin C supplements, and of course, in the end, have a little fun. On our research, we find out Mediterranean diets are great for lowering uric acid in your body. Consider buying a Mediterranean cookbook. Oh, enjoy a nice meal at a Mediterranean restaurant. Especially at this lockdown time, it will be helpful, and you might get half price, who knows. But anyway, this is our YouTube edition. Please subscribe to Health Talk with Dr. Akram YouTube channel, and you will get more updated programs every week or twice a week. There are lots of programs planned, and you don't want to miss them. Thank you for staying with us on Health Talk with Dr. Akram. If you have any further questions, please message us on our dedicated YouTube channel, Health Talk with Dr. Akram, or on Facebook or Twitter, and we will respond to you as soon as we can. But for now, look after yourself. Goodbye. Take care.